Hi, my name is Caleb Blair, and this is my in-service project covering asthma and physical therapy. So, to get started, let's talk about what asthma is. So, asthma is a respiratory condition where air becomes trapped in the lungs. The air becomes trapped because there's something that triggers an immune response that causes bronchial constriction and extra mucus to be produced. Some of the more common triggers that we have are respiratory infections, such as that you get from colds. You have airborne allergens and poor air quality. All of these things can trigger an immune response, like I said earlier, and that constricts the bronchioles and stops the mucus from being moved out. Now, having mucus in our lungs isn't a bad thing. The mucus is there because it traps some of these things that aren't supposed to be there, and the cilia move it out. However, during an asthma attack, the inflamed bronchioles makes that a lot more difficult. And we can breathe in just fine, but exhaling is a lot more difficult. So some risk factors for asthma are smoking. The smoke damages the lung tissue and also it can become trapped within the alveoli, which causes inadequate perfusion. Obesity is another risk factor. The extra weight makes it harder for you to breathe. You have to work harder to bring that air in. Chemicals and other fumes, again, much like smoking, that can damage the healthy lung tissue. Inhaling carcinogens or the fumes can be trapped and damage the tissue over time. And there's thought to be a genetic component to asthma that can be passed down from family member to family member. So let's talk about the three common types of asthma. So first is exercise-induced asthma. This is typically caused by strenuous activity. So when we are exercising pretty hard, we have a tendency to breathe in through our mouth rather than breathing in through our nose, which normally humidifies the air before it gets to the lungs. Breathing in through the mouth brings in cooler, drier air, which irritates the bronchioles. Our lungs are very sensitive to changes in temperature, and this can trigger bronchial constriction to occur. The second type is allergy-induced asthma. So you inhale something, an allergen that irritates you and causes an immune response that causes the bronchial constriction and again the increase in mucus produced. And then the third type is occupational induced. So the environment that you work in could have poor air quality or chemicals in the air, and breathing that in over time damages the lungs, as I mentioned earlier. So when you are having an asthma attack, you can use an inhaler for relief. These are typically bronchodilators, and they do exactly what they sound like. They dilate the bronchioles. In the picture, I have a chamber attached to an inhaler. This is used to help the medication linger longer so a person can take it in more effectively. So how can physical therapy help with asthma attacks? Well, physical therapy does not get rid of asthma, it more so helps to manage the symptom. So the first technique that I want to talk about is breathing techniques. So proper breathing techniques that are helpful for reducing symptoms that can help control the wheezing factor that you have and also help control your respiratory rate. The first breathing technique I want to discuss is diaphragmatic breathing. So in the picture, I have an individual who's laying down. So they have a hand on their stomach. Typically, there's one on the stomach and one on the chest when you're teaching a person to use their diaphragm to breathe. You want the hand on the stomach to rise, not the hand on the chest, because that's how you know that you're using the diaphragm more. When we breathe in, our diaphragm contracts down, which makes our stomach rise, so to say. Diaphragmatic breathing is better because that doesn't stress you out and doesn't use the accessory muscles, which can become fatigued quite easily. Pursed lip breathing is one that's good for actually managing yourself during an asthma attack because you're controlling the amount of air moving in and out of your body at a more consistent rate. During an asthma attack, because we can't breathe, we panic and our respiratory rate increases. But if you can sort of manage your respiratory rate, then you can decrease your symptoms and in some cases buy yourself time to get to your inhaler. The third type of breathing technique I want to discuss is yoga breathing. So with yoga, there's a huge emphasis on concentrating on your breathing and also holding different postures while concentrating on your breathing. So this can be good for if you're easily triggered by asthma, like during exercise-induced asthma, for an example, you can concentrate on your breathing to try to relax yourself before you get to a point where it's an emergency. The Next and final technique I want to talk about is postural draining and percussion. So the goal of postural draining and percussion is to help clear the mucus from the different lobes of the lungs by moving the mucus into a larger airway so that it can be coughed out. So it's a form of chest physical therapy. I have a picture of a hand. That's how the hand is typically cupped. So you use it to sort of pat the person on the chest and on the back, on each of the different areas of the lungs, the different lobes. And what this does is this helps loosen the mucus in the lungs. The mucus is moved into the larger airway. This typically happens. So after you do the percussion part of it, you want to use a flat hand to help vibrate the mucus. This helps move it into the larger airway. And then you cough it up as sputum. That's where we get the yucky green or yellow spit that happens when we cough really hard. So a typical session of postural draining and percussion therapy is usually 20 to 30 minutes. The positioning more helps with the movement of the sputum, so you have the person in different sitting and sideline positions to, again, help guide the drainage of that mucus. And this brings me to the end of my presentation. The reason why I was interested in this is because I have asthma, and I remember being a child, my mom was taught a form of the percussion therapy where she would pat my back to help sort of loosen the mucus I had in my lungs during an episode where I was wheezing profusely. And I didn't know that this could be applied to physical therapy. So I wanted to use this project as an opportunity to bring awareness that physical therapy could be more versatile. It can be applied to more than just helping a person recover from an injury. It can be applied to a variety of things. Thank you for your time.